the door is really wide open from care delivery at an organizational level to systems, to nonprofits, to research, to government and advocacy. There's really no places that healthcare doesn't touch, if you think about it.
So what types of organizations employ healthcare administrators?
Obviously, there are things like acute care facilities, hospitals, those kinds of things, ambulatory clinics. Think about your local primary care provider's office, your oncologist's office, whatever the case may be. We see a lot of students nested in those areas. But then you think about this from how healthcare is positioned, right? It's not just an individual organization. It's really systems level. Myself, I spent many years working at an acute care facility that was part of a larger health system. As I grew, I got to work and take responsibility for multiple facilities, multiple hospitals. You also can work in clinical research organizations, whether it's a clinical research hospital or for manufacturers and pharmaceuticals doing clinical trials. But then you also can have a focus on the nonprofit perspective too, if that's something that really drives you, right? If you're really connected to specific patient populations or mission-driven type of approaches. There are multiple organizations that run nonprofit healthcare at a national and even global level. And then probably one of the other areas that maybe sometimes gets overlooked is in the education realm. You can become a faculty member like I am, or you can work as a nurse planner if you have an RN or clinical background. We also see it finally in the government and agency realm, looking at roles like in the CDC or in NIH, which is the National Institute of Health.